I'm going to make an argument today that I expect may have some resistance against it. Given this, I'm going to need a little bit of help from the audience to prove my point. Now, also, naturally, since I'm a professor, the only way that I really know how to collect data is by testing you. So, little pop quiz for you. We're going to make this easy. All I want you to do is lift up your hand if you've ever been to a doctor. Okay, good. So I've got a panel of experts. This is important. Great. Question 2 is going to be a little bit trickier. Now, I want you to revisit every time you've ever gone to your doctor in your life. Think about the questions that your doctor has asked you and whether or not they ever asked you how happy you were. Just lift up your hand, all of you. I'm sure there's lots of you. Right. There's no hands here. And that's because I'm going to argue that doctors should, but don't necessarily care about your happiness. Now, some of you may be thinking, well, this is silly. Why would a doctor who has such a busy schedule and limited minutes to spend with the patient bother wasting their time, their precious time, asking you a question about your happiness? This can't possibly be that important, and they're just too busy. So maybe that is one reason. Maybe it really is just time. But I think it's actually a little bit more complex than that. So you can see here I have a stick figure with his head torn off, and that's because I think the medical model is still training doctors in a way that's similar to dualism, if you remember that from your old philosophy classes, which is that we separate the mind from the body. The biomedical model really focuses on looking at pathogens and viruses and these external factors and how they influence health and disease, as opposed to thinking about internal factors like your psychology and how that might actually make a difference for your health as well. And maybe it's really how we train our doctors that's making them not care about your happiness. Now, my own experience with this is from when I was a graduate student and I was eagerly learning everything I could about the field of psychoneuroimmunology, which I know is a mouthful. All that means is the study of how psychology and immune function interact with each other, and there are entire conferences devoted to this, journals devoted to this, and so I eagerly, as a graduate student, went to an immunology class at the local med school hoping to learn more, but was surprised. Because in the entire course that I took, not one class was devoted to studying anything about psychology. And in fact, in the entire time that I was taking this class, there was only a single bullet point devoted to any psychological factor, which read, stress influences immunity. And that was it. And so that was a big aha moment for me, because I realized that really doctors were not being taught to care about psychological factors in the same way that I was as a health psychologist. Now, my next lesson in doctors not really paying attention to happiness came more recently when I was doing some research. Now, as a health psychologist, I study how emotion and health interact with each other, usually in a very specified population. So I might look at, say, in Irvine, how happiness influences health in a subset population, maybe even just on the UCI campus. Fortunately, in collaboration with the Gallup organization, I was able to expand this quite a bit by looking at the Gallup poll data, which is a set of data testing 150,000 people from 150 different countries around the world that represent ages from about 18 to 99, and look at whether or not the happiness effect on health is just something local, or whether or not it actually influences everyone, no matter what country that they live in. And in fact, surprisingly and amazingly, that's what we found, that it didn't matter what country that you lived in. If you were feeling more positive, you were more healthy. And even more amazingly, this effect was actually more powerful than a lot of the major things that public health officials look at because they think they matter so much to health, like going hungry or not having shelter or being concerned about your safety needs. The effects of positive emotion were actually more powerful. So when I presented this at a health psychology conference, applause erupted, jaws dropped. People were so excited. This was such an important finding. And so they demanded that I immediately send these findings out into the top medical journals that were out there so that MDs could learn about how important this was. Now, if any of you have ever sent a journal article out to a very top journal, sometimes you get rejected really quickly. And with me, that's exactly what happened. Within about a few hours, the editor didn't even bother sending it out for review. He just said, I'm sorry, our readers, who are basically all the doctors on the planet, don't want to learn about this. Now, you might be thinking to yourself, well, maybe the reason they don't care about this is because it's just not that powerful. So maybe the kinds of things that doctors ask you about, things like smoking or when they weigh you to get your body mass index, these things are just so much more powerful that we shouldn't even bother worrying about psychosocial factors. Fortunately, people have actually done this exact test by doing reviews of the literature, looking at whether or not these kinds of factors compare in quantity in terms of their effect on our health. Now, I'm going to give you an example from social relationships because not only is happiness so tightly intertwined with our social relationships, but social relationships are actually the most studied psychosocial factor in all of health psychology in terms of health outcomes. Let's look at an obvious one. Whenever you walk into a doctor's office, one of the first things they do to you is they weigh you. And that's because people who are lean tend to live longer than people who are obese. And in this case, it's about a 20% decreased likelihood of dying if you're lean versus obese. So nice, strong effect size, great. Even more importantly, people who drink to excess are not going to live as long as people who drink at a sort of healthier rate. And so if you don't drink alcohol excessively, you're going to have about a 30% advantage in terms of your survival as compared to someone who's a heavy drinker. Now here comes the big bad guy, smoking. I don't think any of you have ever successfully escaped a doctor's office without them asking you, are you a smoker? And that's because smoking is, in fact, one of the biggest predictors we have in risk factor research in terms of how long you will live, with about a 50% decreased likelihood of dying if you're a non-smoker as compared to smokers. So where would social relationships fit in here? How high will that bar be? You know, I'm sure you're all guessing, but you probably didn't expect this. Which is that when we look at these reviews of the literature, we actually find that people who are socially integrated versus socially isolated have about a 50 to 91% benefit in survival versus isolated people. But your doctor probably isn't asking you how many friends you have. If odds ratios are hard for you, let me break it down a little more simply to how many years that you are alive. And what we've seen in my own research is that people who are more positive live to a healthy long life of about 80 years old, but not so much for the people who are less positive. And so what this amounts to is about a 5-year difference. Now, I don't know about you, but to me, 5 bonus years of life is something that seems worth investigating in the medical field. Now, it's not just mortality. So I know a lot of you are young and far away from dying, and so let me also tell you some other benefits of positive emotions. If you are in a good mood, you tend to feel healthier, less pain. You tend to be less likely to have injuries and fall, and this is true from everyone from teenagers to older adults. And if you get diagnosed with a disease, what we actually see is that people who are more positive actually do tend to live longer than those individuals who are less positive. And so we get this nice benefit in people, for example, who have early stage cancer, early stage HIV, where they actually survive longer. Now, of course, many of these studies are correlational, and they're also diseases that you might not be, too close to. So let me give you a really, really important example from the literature where we're actually able to experimentally induce illness and look at whether or not people with certain traits, like happiness, actually do better. In these studies, what we do is we bring people into a hotel, healthy, nice population like you. We then let you get comfortable for maybe about 24 hours. And then after you're comfortable, what we'll do is have you lie down and actually spray cold virus into your nose. Now, this is one of the few viruses, one of the few illnesses where we can actually experimentally expose you to it, and that's because it's a common cold. This is something that's pretty normal in your typical life. But the really interesting thing we can do is we can look at what factors predict if you actually get sick, and not by asking you if you feel sick, but by actually objectively looking at whether or not that virus is replicating in your body and producing multiple versions of itself to get you sick. And more interestingly, we can actually look at your mucus weight as an objective indicator of your illness. And you might be wondering, how do you measure mucus weight? Well, we literally collect every tissue that you blow your nose into and then weigh it, subtracting the weight of the tissue, subtracting the weight of the plastic bag. Science is awesome. Given that, we can look at, for example, if we bring a set of happy people into this hotel and expose them to the cold virus, are we able to see a benefit where they get sick less? And in fact, that's exactly what we see. People who are the happiest coming into the hotel, independent of any health measure you can throw at them, are about 19% likely to catch a cold, whereas people who are the least happy coming in have about a 34% chance of catching a cold. How is this possibly happening? How is something as intangible as happiness working its way under your skin and actually having an objective impact on your body and your health? Now, fortunately, me and many other researchers have done work on this, and we've found that positive emotions are associated with a host of physiological benefits like lowered blood pressure, better immune system function, better stress hormone levels, and even engaging in healthier behaviors like sleeping better or getting exercise more often. Now, since I mentioned psychoneuroimmunology to you earlier, I am going to give you an example from the immune function literature that we've done ourselves, and something that's maybe a little easier for you to understand than raw white blood cell counts or something like that. And the paradigm I'm going to tell you about now is a wound healing paradigm. What we do in these studies is we actually injure you. And so it's a kind, gentle way of injuring. We put a piece of tape on your arm and we rip it off. That doesn't sound too bad. But then we do it about 50 times. And at the end of that, we'll actually be able to objectively tell how quickly you heal by the amount of moisture being lost from that point on your arm. And what we see in these studies is that when we look at healing, individuals who come into this lovely wound healing experiment are about 50% healed at 2 hours. But individuals who are coming in less positive are about 20% lower than that. Objectively, differences in healing time. What do we do with this? Obviously, many of you probably realize that some people are just naturally happier, but the good news is that lots and lots of researchers are actually looking at ways to make you happier. And there are tons and tons of TED Talks on this exact topic that you can just Google and find on your own. But I will give you one little hack to make yourself happier that we've actually looked at in our lab, which is looking at something called the facial feedback hypothesis to improve your health. So what facial feedback hypothesis says is that when you smile, even if you're faking it, the muscle activation in your face sends a message back to your brain saying, hey, you're pretty happy. And that in turn is associated with all sorts of benefits. We did this in our lab, and you can see we've got an array of different expressions from neutral to happy to really, really happy, with the biggest sincere sort of Duchenne smiles, what we call that, on the right side. Then we had people holding these chopsticks do horrible, stressful tasks, because we like abusing our subjects, apparently. And so in this case, we had them put their hand in a bucket of ice water for about a minute, which is extremely painful and elevates their heart rate, and then found, really amazingly, that those people who had the biggest smiles on their faces had the fastest stress recovery. As you can see, that green line, their heart rate is dropping faster and to a lower level than those individuals who aren't smiling. Even with just these chopsticks in their mouths, we're seeing this amazing stress benefit. We wanted to take this finding and really push the limits and try it in a health-relevant background, which is getting a vaccination. And so what we actually did is the same smiling manipulation and had people put chopsticks in their mouths while they were getting a needle. And he's not happy, but he's smiling. And what you're seeing is that just simply holding those chopsticks there while you get a vaccine-like needle resulted in a 40% reduction in pain, just by smiling. So my message is then, while it seems inconsequential, psychological stuff like happiness actually matters a great deal for your health. We have to teach our doctors, our medical students, our grant providers, our government, our public policy makers that this stuff is not fluffy and unscientific and that we can't really ignore it anymore. Now, my final message is this. Contemporary medicine can benefit from reattaching the mind to the body. I implore doctors to pay attention to this data, to start thinking about putting positive psychological assessments into their standard medical evaluations, and to really push the boundaries on how we train medical students and even how we pursue wellness in our patients. Because it's only when we start looking at this compelling literature and taking it seriously that we can create a population with an optimal quality of life and maybe, just maybe, a longer quantity of life. Thank you.